Over several years of preparing NCLEX candidates and nursing students for their exams, we have developed a process for students to master as they approach NCLEX-style questions. We call this D&D's Mind Deep approach to nursing competence. Nursing process is at the heart of delivering competent and effective care to patients. However, the complexity of human systems, challenge of expanding nursing roles, and the involvement of multiple clinical professionals in delivering care can make it easy to overlook what is really going on or what is most important to address. NCLEX-style questions aim to simulate exactly these complexities and test your depth of knowledge and judgment on how you would respond as a competent nurse. D&D's Mind Deep approach starts at the 4 levels of knowledge. In nursing school, your instructors ask you the never-ending whys. This method is how we nursing educators try to coach you through achieving deeper understanding of nursing concepts. In order to adequately prepare for clinicals, nursing exams, and the NCLEX, you should learn to adopt and anticipate the whys. Asking the right questions and digging deeper into the concepts you are learning allows for more precise understanding and better retention of the information. In diamond mining, before you start, you must plan your dig in anticipation of potential distractions and dangers and making sure you have the tools to address them. In testing, you start at making sure you identify what the question is asking. This can be achieved by getting in the habit of extracting the topic and stem of every question, even before you look at the options. This will lead to a stronger ability to eliminate distraction and help you to focus on the critical problem. If English is not your first language, or if you frequently miss important words and questions, this is a critical step in adding to your test-taking habit. Let us look at a couple of questions and see if you can extract the topic of the question and the stem. You have a 45-year-old salesman admitted to the hospital for abdominal surgery. The nurse teaches the patient about post-op complications. Which statement, if made by the patient, would indicate to the nurse that further teaching is necessary? The extracted topic is post-op complications. A stem is what about the topic are they asking? In this question, the extracted stem is further teaching necessary. So if you rephrase the question and put it simply, it should lead you to what is not true about post-op complications. Let us see if you can extract the topic and stem in this question. The nurse describes the procedure to a male client for collecting a clean catch urine specimen for culture and sensitivity. Which of the following explanations by the nurse would be the most accurate? As you start to receive higher levels of questions like application and analysis, you are now expected to modify your responses based on situational scenarios. Be aware of prompts that should lead you to use nursing decision-making tools. The best tools for use for application and analysis levels include Maslow's hierarchy and prioritization, independent versus dependent nursing actions, nursing process for decision-making, expected versus unexpected, and delegation within a scope of practice. Think of these as formulas or recipes in managing patient problems we encounter as nurses. Depending on the question, you decide which recipe or formula would best fit in order to arrive at the solution. D&D will address each of these tools individually in our upcoming videos. Now, do you need this level of processing for all NCLEX-style questions? Absolutely not. It all depends on the level of question you receive. Just remember that as you progress in nursing school and in preparation for NCLEX, you must eventually be able to demonstrate an ability to turn book information into competent actions. Your persistence to dig deep into the understanding of nursing content is the ultimate measurement of an entry-level competent nurse. The best way to dig deep depends on the time you put into practicing. Knowing something is missing with your process is not the same as knowing what is missing and how to fix it. You need a way to visualize the flow of nursing work, identify expected and unexpected outcomes from patient care, and understand how you interact with tasks, people, and the healthcare system itself. Following our proven Mind Deep approach to nursing competence will allow you to be a better prepared and successful student and NCLEX candidate. Remember to like us on Facebook and subscribe to our Vimeo and YouTube channels to receive NCLEX review concepts in minutes. Contact us through www.dndeducators.com to request free access to complete video series of our NCLEX and Practice Ready, a critical thinking and test-taking event where we dive deeper into D&D's mind-deep approach to NCLEX success.